ovarian reserve basically is the number of follicles that you have in your eggs, in your ovaries. If you look at women, say in their 30s, and you measure their ovarian reserve, you're going to look at their antral follicle count, which is a number of follicles that you see when you do a transvaginal ultrasound. They're very small. They usually measure less than 8 millimeters in size. And that gives you an idea of how many follicles that are going to be recruited, say, that cycle. So it does give you a sense of ovarian reserve, and that's generally done on the second or third day of the menstrual cycle. Ovarian reserve is also a great way for us to know how do we treat this patient. If a young woman comes in, generally if she's in her early 30s, we're not going to be aggressive with that patient. We're not going to tell her go straight to IVF because she's young. However, if we measure her FSH level and that's high, or if we measure AMH level and that's low, and we look at her ovaries and they don't look like there's a lot of antral follicles, we may actually encourage her to be more aggressive. Likewise, if we have someone who's over age 40, we generally recommend they be more aggressive, again, because even though they have good ovarian reserve, their chances of pregnancy are not going to be as good as someone who's, again, in their 20s and 30s. There is a point where we have to explain to the patient, particularly if they're older, if they have poor ovarian reserve, that there's not a lot of options that we have. There's nothing that we can do to make their ovarian reserve better. We can't make them have more eggs. We can try to stimulate them. We can try to increase their chance of pregnancy by doing in vitro fertilization. But in terms of really the long-term prognosis, and sometimes we have to tell them that, for example, we may have to recommend egg donor if we see that the FSH level is high, and the AMH level generally corresponds with that. It's generally low.